Okay, so I've just come from surgery where we did a bone graft 7 months ago. We came back today and took out the membrane, and I extracted 4 teeth, and I've placed 4 additional implants. So the patient has 5 implants, and I've done an impression at surgery. This is the way we make immediate fixed temporaries for patients who desire them, and for patients whose implants are tight enough that we can actually make them an immediate fixed temporary on fresh surgical implants. So I'm going to be in here in the lab for about 90 minutes working on making the temporary myself. I do all this myself. I don't have a lab technician come in. I want to make sure that the patient's getting my expertise and not somebody else's. So the patient is numb and waiting for me to come back for our first try-in. So what I'm going to do first is take this impression and I'm going to connect analogs to it. And this will create a preliminary master cast on which I can make my temporary, my fixed temporary. Okay, so I've attached the lab analogs to the impression, and I've poured what's called a soft tissue model. So I'm going to trim this just a little bit before I pour the stone model into it. What you'll recognize about all this lab work is that it's very, very tedious, and there's many, many different parts and procedures that need to go into it. And things can go wrong at any level. So that's why I like to do this myself. It's a great service for the patient, but it also is quality control for me. I'm not going to let a patient get out of the office with anything that's less than what I consider to be acceptable or even better. So now I've trimmed the impression, I've got my analogs in place, and now I'm ready to pour it in stone. So now I'm pouring the stone into the master, or into the surgical impression. And this will create the working cast that I'll make the temporaries from. For this technique, we use fast setting stone. We're trying to minimize our amount of time it takes us to make these because the patient is in the chair waiting for them, and we try to give them as little anesthetic as possible, local anesthetic, so that they're not uncomfortable during the waiting period, which will be close to about 90 minutes, and then another hour to adjust it in the mouth. Okay, we've poured this cast now in fast set stone, so we're going to take it apart now, and I start by unscrewing the impression coping screws one at a time. There are so many little steps in this process that I'm amazed that I don't forget any. And I'm also, whenever the patients have an opportunity to watch this, they are surprised how many little steps there are in the process. So now I've got the screws out, and now it's just a matter of separating the cast from the impression. So there we go. There's our master cast. And the soft tissue models are still stuck in here. So what I'll do next is pull these out, trim these, and then put them back on the model so that I have the soft tissue represented in the cast like it is in the patient's mouth. Okay, so I've pulled these little soft tissue representations out of the impression, and I'm trimming them to put them back on the model. And this is just something you learn from experience. You trim the bottom side of these so they fit the model better. And then when you go to put them back on, they go into place just like that. And now that's the representation of the soft tissue in the mouth. And so that's the way the soft tissue model works. Now I'm going to take a minute or two and go and trim the rest of the stone model. So the next step in the process is we have a template that was made from the patient's original teeth that we improved with wax. And so we're trying this template on my surgical model so that I know how to adjust my cylinders that will serve as the base for the temporary. And the way we do that is we try things back and forth. We cut them off at a certain height. So that when we try this back on, we have the approximate height that we need for the acrylic to flow around this cylinder. Okay, so I now have taken we call this a copy-plast template. It's the outline of the teeth that we want her to have as temporaries based on her original teeth. And I've taken my temporary titanium cylinders and I've cut them down to the right length so that my acrylic will flow around them and capture them in the temporary. These long pins are simply a means of maintaining a screw access hole, and it fits down over all those just like that. So the next step that I'm going to do is mix my acrylic, pour it into the template, and then seat the template back over the model and form teeth that look something like that. Okay, so now I'm at the point of being ready to do the actual temporary itself. My cylinders are trimmed and ready. My template has holes in it and it's ready to go. So now I have to mix my acrylic that will form the actual teeth of the temporary. And it will also connect to those cylinders that it took me so long to get ready. So now it's a nice doughy consistency. I have it where I need it. So the next step is to put it back on the model and orient it accordingly. So now I'll seat this all the way down until it sits on the model the way I want it to. And I'll begin removing some of the excess before it sets so that I'm not fighting it later. It's very hard acrylic. And the more you can do now, the easier it becomes later. And again, these long posts are actually protecting the screw channel, which is how we're going to secure this ultimately. And for the last 10 years, we've always used screws rather than cement. We found out 10 years ago that the cement was pretty toxic to the soft tissue and the bone around the implants. So we try to do screw retention 100% of the time now. And you can see it doesn't look like much just yet, but we've got a pretty nice outline of the teeth, individual teeth, and I'll be adding and subtracting to those over the next hour or so. So we hold this until the material sets, and then we'll have some semblance of a temporary, at least an outline for a temporary that we'll use back and forth in her mouth. Okay, so I removed all my 5 long screws here, and then I remove the template and I get down to the actual temporary. And this is going to take a lot of refinement, but this is what gives us the outline. And now I have to get it off the model. Slowly tease it off. And so there we are. There's our temporary. We still have a little bit of this is the soft tissue that I put in earlier, and it'll pop right out. And now begins the part of addition and subtraction. To make it look pretty, we'll add and subtract, and to capture these cylinders better with acrylic, I'll add around each cylinder, and that will also help shape the tissues as they heal. So a nice smooth interface that mimics the tooth that should be there is how you want to shape these temporaries, so that when everything heals, you've developed the soft tissues the way you want them. So you can actually do both. This will serve as an aesthetic temporary, but it also enhances the soft tissue healing when done correctly. So I'll be here for the next 30 minutes or so adding and subtracting to this and trying to make the contours just right, so that when we take it to the mouth, it's as close as possible. Okay, so now we're just removing the extra and getting ready to add where I need to. So like I said, it's a big day of adding and subtracting certain places and developing the tissue. So I'm ready to move on to that next step. So the way we do the sculpting and the shaping of the tissues is we use powder and liquid form, and we go around the cylinders and we create that. The technical term for it is called Emergence Profile. It's how the implant restoration emerges through the soft tissues. And we know what that should look like because we know what teeth should look like. So what I'm doing now is I'm adding those areas to the temporary, so that when the tissues heal from surgery, they will be sculpted or shaped just like that tooth would be if it was a natural tooth. It's a really important part of doing any temporary on implants is to get this emergence profile right. So I was saying that I like to do this myself. There are lab technicians who can do this and who are very good at this. Certainly most of the time far better than dentists, but the reason I do it is, one, I can, and I've got a 100% vested interest in the success of these cases. The lab technicians maybe don't always have that level of concern, but I want these things to be perfect in every way that I can make them. So this is the culmination of 30 years of doing lab work that, most prosthodontists, that's how we grow up, so to speak. We do our own lab work. From the time we're residents in school all the way, and many of us continue to do it throughout our careers, so that little things like this are just a normal progression of that learning curve. And like I said, I've got a 100% vested interest in the well-being of the patient, the well-being of the implants. And when this temporary goes in, it's got to fit passively on the fresh implants that were just placed. It's got to replace the teeth aesthetically. There's a lot of little nuances about what I'm doing here that most people would never appreciate, but there's dozens and dozens of steps that go into doing it properly. And creating this contour is one of them. It's not by chance that the tissues heal beautifully and perfectly. It's based on our temporary. So that's why I take my time and try to get it just right. Okay, I'm in the addition phase now here for a little bit. This is actually one of my favorite parts, is to make these temporaries look pretty and natural as much as I can. So I'm in the addition stage here, just adding some shape to each one of these teeth with a little bit of the temporary resin. And this patient has we're not doing her lower arch right now, so I'm having to follow her lower teeth. And so this won't be one of my prettiest temporaries, because I am actually married to the lower in this situation. So see, this tooth I'm working on right here is going to end up being shorter. She has a class 2 deep bite, which probably doesn't mean much to the audience here, but class 2 deep bite, the front teeth overlap the lowers by quite a bit in a vertical dimension, and we end up having shorter back teeth because the front teeth have to be a certain length for aesthetics, but the back teeth are dictated by the bite. So you'll see as we make progress here that is going to be our limiting factor today. And even if she was willing to do her lower arch, she still is a class 2 deep bite, which is a skeletal issue. It's not a tooth issue. So we might be able to change that a little bit, but typically the skeleton dictates the position of the jaws in a class 2 deep bite situation. So yeah, we couldn't have improved it a whole lot even if we did her lower. So okay, so we've got this ready to try in the mouth. It's starting to look like teeth, and so I'm going to take it to the mouth. But the one thing I do in the mouth, I section the pieces between the implants. Why do I do that? So that I'm absolutely sure that each implant temporary cylinder fits each implant perfectly. This material, acrylic resin, shrinks when it sets. So this is not accurate. Even though I made it on the model from the impression and everything else, this is not accurate because the acrylic was shrinking as it set. So now I have to separate these in the mouth and readapt them in the mouth so that I can have a perfectly fitting temporary, and I'm not going to be binding on any one of the fresh temporaries. Okay, so I just got back from the surgical room, and I cut this into 3 pieces and then put it in the patient's mouth in 3 pieces, and then connected it so that each one of these 5 cylinders sits perfectly on top of the implants. So now I'll just add a little bit to where I had a few voids by doing it in the mouth, and we'll be ready to start the final polishing and preparing for the delivery at the end of the appointment. And now that the temporaries are adjusted and polished, we place them in the mouth. This picture shows immediate placement at the day of surgery. Then we'll fast forward 2 weeks to this picture that shows the temporary and the tissues healing. There's additional healing that needs to take place, but it's the shape and the contour of the temporaries that causes the tissues to heal so nicely.